For too long, our societies have been approaching problems in silos, but people don't live their lives in silos. If you are a child, if you are a mother, if you are a family, your lives are affected by many different ministries. The Ministry of Health, the Ministry of Education, the Ministry of Social Affairs, depending how it is organized in countries. But these ministries don't work together, and they actually split up people's lives as each of them is trying to support them. That's why it is absolutely critical that we find new ways that these ministries, be they at the national level but also at different levels of governance, find a new way to work together holistically so that they approach problems and challenges, but also developing potentials of people in a way that brings it together, that creates synergies, and that makes people's lives easier, not more difficult. The SDGs are historic because the SDGs, for the first time from the United Nations, give the absolutely clear message: we cannot solve problems one by one. We cannot solve problems in silos. Again, we need to bring them together and find transformative ways of implementing them. Again, transformative ways of doing policy, of implementing policy, but also in helping people live their lives in different ways, because it is frequently our environments that actually stop people from living a sustainable and a healthy lifestyle. So Health 2020 had already picked up this notion of bringing things together, and there is nothing better for Health 2020 than to now have the SDGs in a way as a support. And the transformative message of Health 2020 is reflected in the SDGs, and the SDGs will help take it forward, just as Health 2020 will support the SDGs. I would ask delegates in Paris to change their perspective. That is, first of all, not to start thinking from individual problems, but to actually try and understand how people live their lives. We have said health is created where people live, love, work, shop and play. And it means you have to have that perspective to understand how people actually live their lives, what support they need to develop their potential, how you can empower them to live their lives. And then you move forward and say, yes, but people are experiencing these kind of barriers: social barriers, educational barriers, environmental barriers. So if you change that perspective, rather than each time start out with a problem, we're going to address drugs, we're going to address tobacco, we're going to address poverty. If you try and create that synergy, change that perspective, then I would hope delegates go back and approach the challenge they have at home in a different way.